Hi, my name is Dorothy Bruce. I will be presenting an analysis of an application called Diabetes Nutrition and Diet Tracker. This app was designed by MyNet Diary. This product is available on the Android market under the name Diabetes and Diet Tracker. It also is available for Apple products that are iOS 7 or later under the name Diabetes Tracker with blood glucose card log. The purpose of this app is to help people with diabetes to track their blood glucose levels, insulin, medication, weight loss, exercise, and food intakes. It also helps them to analyze ingredients in foods and the product nutrition labels. Nurses and patients both benefit from this application. In the medical field, this app is useful for many different types of nursing. It would be most useful for a diabetes resource nurse. She or he can use this app to educate the patient on carbs, net carbs, and diabetes-specific products. The diabetes resource nurse can teach patients on how to keep track of and how to log their medication on this app. The staff nurse also uses this app when the diabetes resource nurse is unavailable. A nursing student can use this app as a learning tool to better understand food choices for patients with diabetes. As stated, the app is useful for the patient as well. The patient can use this app to scan UPC codes on foods to review nutritional ingredients. With this app, she or he can track his or her exercise by synchronizing MyNet Diary to patients' Fitbit, Apple Watch, or other exercise tracking devices. According to reviews, the application has pictures and examples for visual cues, which make it simpler for the layperson to follow and understand what should be documented in a particular area. The application graphs the user blood sugar and levels and shows the date and how high his or her glucose levels are. At a glance, the user can glimpse the days that his or her blood sugars are elevated. In conjunction with the use of the diary, he can see which foods have been eaten that day, which could have caused a spike in blood glucose levels. When using this application, the user must register and provide personal information. The app states that it uses encryption technology to safeguard user information. If the company is sold, private information is shared with the new company. This is disclosed in the user agreement. Furthermore, PayPal is an option to process transactions made by credit cards. If a credit card is used to make a purchase, it is only stored while the transaction is taking place and then deleted from the database. There are no legal issues at this time with this app. My overall analysis of this app is that it appears to be a useful tool with newly diagnosed or chronic diabetic patients. The nurse can use this app to educate or provide up-to-date information to a patient to give guidance on medication and insulin tracking. The patient can sync their Fitbit, Apple Watch, or other exercise devices to this app to track their progression. It's available on both the Apple and Android markets. The limitations of this application are few, but do exist. One limitation is that an Apple user must have iOS 7 operating system or greater. Another limitation is the cost of the application, which is $9.99. This cost could be preventative for patients who are having financial difficulties. In conclusion, the presenter recommends MyNet Diary for nurses and patients who are able to afford the application. MyNet Diary is a useful tool in monitoring and managing diabetes. Nurses would benefit from this app because it can be used as a great educational resource for patients and for nursing students who are learning about diabetes. It doesn't matter if the user has an Apple or an Android product. If the user can afford it, it would be worth downloading this application.